I'd like to request a statement from the Cabinet Secretary for Health and Social Care regarding trauma and orthopaedic waiting times across Wales. The average waiting time for a first outpatient appointment in the Hywel University Health Board area is 18 weeks, and the average waiting time for someone to actually start treatment is 28 weeks, with 10% of people waiting a staggering 79 weeks or more to start treatment following their referral being received by the hospital. Now, Trefnydd, these figures are absolutely unacceptable because people are living in pain and discomfort while they wait for much needed treatment. Improving access to healthcare and reducing waiting times should be a priority for this government, and it's important that we hear from the Welsh Government what is being done to support health boards to bring down these waiting times. It's been almost 6 months since the last oral statement on waiting times, so I'd be grateful if we could have an update from the Cabinet Secretary for Health and Social Care on how the Welsh Government is helping to reduce waiting times and ensure that patients waiting for orthopaedic treatment are able to receive it as quickly as possible.
Well, thank you for that question. And of course, waiting times and bringing down waiting times is absolute priority for this Welsh Government and indeed for the Cabinet Secretary for Health and Social Care. And indeed, it is a priority of the new Director of the NHS in Wales and all those who advise us, and indeed all of those who are delivering that reduction in waiting time. So again, thank you for raising this. Again, it is important that we see the progress that is being made in terms of bringing down those waiting lists and waiting times.